For decades, beta blockers were a standard prescription after a heart attack, believed to protect the heart and extend life. These medications were thought to be essential in reducing the risk of another heart attack and improving overall survival rates. But with modern treatments, like quick artery opening procedures and powerful statins, most survivors now leave the hospital with their heart function intact. These advancements have significantly changed the landscape of post-heart attack care. This progress has sparked a crucial question. Do all heart attack survivors still need lifelong beta blockers? The medical community is now reevaluating the necessity of these drugs for every patient. Side effects like fatigue and depression are common, so unnecessary prescriptions could harm quality of life. Patients often report feeling more tired and less able to enjoy daily activities. Two major European studies presented in 2025 have challenged the old dogma, revealing that the answer isn't so simple. These studies have opened up new discussions and debates among cardiologists worldwide. For the first time, researchers directly compared beta blockers versus no beta blockers in patients with normal heart function. The trials aim to provide clear guidance on whether these medications are still necessary. The results? Conflicting, and they suggest the future of heart care may be more personalized than ever. This means that treatment plans could be tailored to the individual needs of each patient rather than a one-size-fits-all approach. Beta blockers are a class of medications that work by blocking the effects of adrenaline on your heart. By doing this, they slow down your heart rate and lower your blood pressure, which gives a healing heart a much-needed break. This action helps the heart use less oxygen and reduces the strain on the heart muscle, especially after it's been damaged by a heart attack. This break effect has been vital for patients with weakened hearts, as it helps prevent the heart from working too hard. Beta blockers also reduce the risk of dangerous heart rhythms, known as arrhythmias, and have been shown to lower the chances of sudden cardiac death in vulnerable patients. That's why, for decades, nearly every heart attack survivor was prescribed a beta blocker as a standard part of their recovery plan. It became a routine step in cardiac care. But today, about 80% of survivors recover with normal heart function, thanks to faster, more advanced treatments and improvements in emergency care. These advances have changed the landscape of heart attack recovery. The big question now is, do these patients with healthy heart function after a heart attack still benefit from taking beta blockers? Or are they continuing the medication out of habit without real need? New research is finally putting this long-standing assumption to the test, examining whether beta blockers are still necessary for everyone. The answer could change how millions of people are treated after a heart attack, potentially leading to more personalized care and fewer unnecessary medications. Let's take a closer look at what the latest studies have found about beta blockers and their role in modern heart attack recovery. Two massive European trials, BETAMI-DAN-BLOCK and REBOOT, tracked over 14,000 heart attack survivors with normal heart function. Both studies agreed. For patients with mildly impaired heart function, beta blockers reduce the risk of death or another heart event, but for those with completely normal heart function, the results split. The Scandinavian BETAMI-DAN-BLOCK study found a 15% lower risk of major events with beta blockers. The REBOOT trial, however, found no benefit at all. This contradiction has left doctors debating, are beta blockers still necessary for everyone? The answer may depend on individual patient factors. The debate is far from settled. Why did these two major studies come to such different conclusions? It's a question that's puzzled both doctors and researchers, and the answer isn't simple. Several factors could explain the disagreement. Differences in the types of beta blockers prescribed, the ages of the patients, and even gender may have played a significant role in shaping the results. For example, the Scandinavian patients were generally older and had milder forms of heart dysfunction. This may have made it easier to see a benefit from beta blockers in that group, compared to others. Another interesting finding, a sub-analysis revealed that women who received higher doses sometimes did worse, suggesting that gender and dosage both matter when it comes to treatment. Meanwhile, the Mediterranean group was generally at lower risk for heart problems, which could help explain why they didn't see the same benefits from beta blockers as the Scandinavian patients did. All of this points to one thing. Beta blockers aren't a one-size-fits-all solution. The effectiveness of these medications can depend on many individual factors. The real benefit may be limited to certain subgroups. such as those with mild heart dysfunction, higher risk profiles, or specific demographic characteristics. To truly understand who benefits most, more research is needed. Scientists are now working to identify which patients will respond best to these drugs. For now, the evidence suggests that a more personalized, tailored approach to prescribing beta blockers is the best path forward. So what should patients do with all this uncertainty? Don't stop or change your medication without talking to your doctor. Abruptly stopping beta blockers can be dangerous. Ongoing research will soon provide more answers, especially for those with completely normal heart function. The future of heart care is moving toward precision, the right treatment for the right patient. If you have questions, discuss them with your healthcare provider, who knows your unique situation. Medicine evolves, and so do guidelines. Expect updates as new evidence emerges. For now, stay informed and keep an open dialogue with your doctor. Personalized care is the new standard in heart attack recovery.